Winston Churchill once said, "We make a living by what we get, but we make a life by what we give." Hi, I'm Gina McClinnick, and as a registered nurse, I've used this philosophy to provide the best possible care for my patients, but I still yearn to give more. I received my Bachelor's of Science in Nursing from Western Michigan University, and I currently work on the inpatient cardiology unit at Borgess Medical Center. Over the last 6 years, I've worked closely with patients and their families with a multitude of acute and chronic diseases, and because of this, I have been rewarded with a vast amount of knowledge and experience that I would use in the pursuit of an advanced degree as a family nurse practitioner. Every day, I see patients and their families struggle to understand and cope with their disease processes, and as a bedside nurse, I feel as though I can only do so much to ease the suffering after the patient is already hospitalized. As a future nurse practitioner, with the knowledge that I've gained working closely with these patients, I could spot early warning signs and provide my patients with the tools and the education they need to prevent or even eliminate complications such as hospitalization. I believe that education of patients and their families is the most vital thing a primary care provider can do to empower them, and I believe as a family nurse practitioner, I would have the opportunity to spend the time arming my patients with the most powerful weapon against these diseases, knowledge. For example, on the unit I work on, we see a lot of patients with heart failure. Most of these patients do not realize that something is wrong until they are in a significant amount of distress. When asked to describe how they're feeling over the last several months, most of them demonstrate many of the signs and symptoms that, had they been taught by their primary care provider what to look for, hospitalization could have been prevented. Along with educating patients and families, I fulfilled many leadership roles in my current position on the cardiac unit. I'm a charge nurse and pride myself in being an approachable resource for my coworkers. This role has provided me with many experiences, especially in emergency situations where I believe my calm demeanor and critical thinking skills are at their best. I am also a member of our department-based Nurses Council and a member of the Nurse Practice Council, both of which use evidence-based research to make safe policies for both unit-specific and hospital-wide. I'm a preceptor for nursing students, nurse externs, and new nurses on the unit, affirming my role as a mentor and educator for not only my patients and their families, but also my peers. These leadership positions have provided me with many opportunities to communicate with people from all across the healthcare spectrum in order to provide the best care for the patients, which I believe is a very important skill that I could use as a future nurse practitioner. Georgetown University's mission to provide the next generation of healthcare workers with a cutting-edge program that still upholds the tradition of caring for patients and families with a moral foundation is a philosophy I truly believe in. I believe this approach considers the whole person, mind, body, and spirit, with the ultimate goal of improving healthcare overall. I also believe that this progressive online program is unique in the fact that it allows me to further my education while still staying current in the field of nursing. One of the challenges I see myself facing in this program is the actual online format, as I have not participated in an online program in the past. However, I believe that this challenge will drive me to work harder and be self-motivated, as I possess the characteristics it takes to be successful. As a nurse practitioner, I believe I can embrace the philosophy that we make a life by what we give to others, and I believe I can do this through the online program at Georgetown University. I would like to thank the faculty at Georgetown for their time and consideration. Thank you.